Hello everyone, it's Jamal Thomas. Welcome to the Progressive Soapbox. This one is probably going to be blisteringly fast. Guys, I've been thinking about varying up the way I do this. I tend to do these videos where I would go in and come out, go in and come out. I do that because I think if there's any kind of problem with the stream, it'll minimize just over a short period of time that I'm doing the video, so it wouldn't be significant. And the second one, it gives me time to queue up the next story, so it makes it a little bit easier. Not to mention, I don't have to cut the video afterwards, unless there's something wrong with the video. But I'm strongly starting to consider just doing like a 3-hour show and just cut the video up. I just don't want to sit there after a 3-hour show and cut up video. I like to get it all done as I'm doing it. Nevertheless, this one is going to be relatively fast, but I thought this was an interesting one and a good one. So there's a study going around by libertarians that said that Bernie Sanders was going to increase healthcare costs by $32 trillion. They were like, oh, look at this study, this $32 trillion. We told you socialism doesn't work. He's a communist. He's going to bankrupt this country with $32 billion in healthcare, $1 trillion in healthcare. We can't afford it. We can't afford it. We can't afford it at all. So, since we can't afford it, why bother? Why bother? Obamacare is the best we could do. We just need to muddle along with Obamacare. Well, there's a study, however, when you look at it, it doesn't really say that. In fact, what it almost says is the opposite. In fact, it does say the opposite. There's certain savings and certain things that Bernie Sanders is going to allow, or the plan allows the federal government to do, which allows them to lower healthcare costs. Meaning that even though there may be an increase in the technical cost that the federal government is paying, the increase or the amount of healthcare costs that we get is less. It lowers healthcare costs, especially when you project this out to, I think, like 2030 or 2022. We save billions of dollars a year, meaning as the United States, we save billions of dollars on the Medicare for All plan. And that's covering all of the Americans. Meaning it's not this guy's covered, but that guy's not, or this guy has to get health insurance, and we're going to compel him to get health insurance with penalty of a penalty. Penalty of a penalty. Yeah. You know what I mean? No, you're an American. Congratulations, you have health care. It's your birthright. It's your birthright. Let's take a read on this. This is Business Insider. That study going around on Bernie Sanders' Medicare for All plan comes with a big catch. The United States would actually be saving money overall on healthcare. A new report from the Libertarian Mercatus Center found that Senator Bernie Sanders' Medicare for All plan will cost the federal government an additional $32.6 trillion over 10 years. But the Mercatus report also found that the national healthcare expenditure, the total amount on healthcare in the United States by the federal government, states, businesses, and individuals will come in below current projections under Sanders' plan. Just like I said, the amount that we pay now in comparison to what we would pay under Sanders' plan. And when you project it out, yes, it's $32.6 trillion, but when you project it out to like 10 years, that becomes less than what we will currently spend. And that's including everybody in the country. That sounds like a win-win. That sounds like a win-win. So while the price tag for the federal government would increase, the total cost of healthcare would go down, and more than 30 million uninsured Americans would get access to healthcare, according to Mercatus' model. Libertarians. Libertarians. A report on Senator Bernie Sanders' Medicare for All plan outlined a whooping cost for the federal government, but the price tag may not necessarily be as overall as eye-catching as it initially seems. The report from the Libertarian Mercatus Center found that Sanders' plan would extend Medicare for all to all Americans, would increase the federal health care costs by $32.6 trillion from 2022 to 2031 if implemented as written. Republicans pounced on the number, arguing that it showed such a plan was not feasible. House Speaker Paul Ryan tweeted, $32.6 trillion. That's how much Washington Democrats' single-payer health care proposal would cost over 10 years. Even doubling our federal individual and corporate income tax wouldn't cover this cost. It's just absurd. But the cost for the federal government tells only part of the story. The government is only one piece of the healthcare puzzle. The Department of Health and Human Services also measures the total amount spent on healthcare in the United States, including by states, private citizens, federal government, businesses, and more. This all-encompassing number is known as the national healthcare expenditure. According to the Mercatus model, total healthcare spending will actually come in about $303 billion lower in 2031 than the current projections, with $7.35 trillion going to healthcare that year versus $7.65 trillion expected now. Total national health spending will be $2 trillion lower from 2022 to 2031 under the plan, the report found. While the price tag for the federal government would increase significantly, decreased spending by other groups would lower the total healthcare spending over that year by over a 10-year period. Meanwhile, the model also assumes that 30 million more people would get access to healthcare, and many people will get more robust services. The savings will come from a variety of places, such as the government ability to leverage its bargaining power into lower prescription drug costs and mandating all healthcare providers take the lower Medicare rate. The study contains assumptions, and there are numerous political and practical concerns in shifting the burden of healthcare payments onto the federal government. But based on the Mercatus model, tens of millions of uninsured Americans will get access to healthcare, and the United States as a whole would end up spending less than it's expected right now. The amount that you plan on spending right now, the country spends on healthcare right now, will go down. That's the point. That's the point. So this one is not meant to be long. I just wanted to give a little bit more context to the study that's floating about, going after Sanders for the health costs. Look, your government just needs to prioritize what it wants to spend money on. What do you believe in? What do you care about? What do you want to spend money on? And if at the very basic level that the government itself can't provide for the well-being of the human beings in that society, such as healthcare, it's the most basic and fundamental thing to a person. If your avatar doesn't work, if you don't have the capacity to get your avatar fixed, your reality, for the most part, evaporates. You have no reality. Imagine, and I say this from somebody in the know, because I've been in that spot. I've told you before, this weird donut hole that exists in the federal government, where if you're a kid with Medicaid and Medicare and Social Security, if you do anything like going to school, well, if you're getting a job to try to pay your way, you will potentially lose your Social Security, and you may even lose your Medicaid, allowing you to be eligible or attacked by medical bills. I don't know if we still have Medicaid in the way that it normally works, but whatever, you get my point. I mean, it puts you in this weird donut hole of, I'm not old enough to get a job that's going to give me decent coverage, but at the same token, if I stay here, I'm just going to remain impoverished because the amount of money that they give is not enough to live off, despite having your health care taken care of. Like, it puts you in this weird spot. Do you want to be poor or do you want to be impoverished? Your choice. Which one? You want to have a massive amount of debt on your back, or you want to be poor? Make your choice. Neither one of those choices are a necessarily good choice, but these are the ways that we present our people. Going from point A to point B, why on earth would you want a society or a medical industrial complex that's predatory on your fuck-ups, foibles, injuries, illnesses? Why would you want that to be a for-profit service? Why would you want them to try to be able to extract the big scars? Oh, a broken thumb? That hurts pretty bad. It probably hurts pretty bad. So let's just patch that up. We'll talk about price after we patch that up, okay? Nobody talks about price in the hospitals. They just do it. I always find that to be weird. You talk about price for everything else, but not in the hospitals. You get charged or whatever they charge you, because when medical stuff comes on the line, your avatar, your body, is the most precious thing you have at your disposal. And any price, no price is too high. So price doesn't necessarily come up. I would imagine some people bring it up. I've never heard anyone bring up this idea of price. Look, the point I'm trying to make is, as Americans, as human beings, just as human beings in general, why do you want your healthcare subject to the whims of some kind of capitalist greed? Why would you want that? Why would you want your insurance carriers to be able to extract, like 30%, just a massive amount of profit, millions of dollars at your expense, in many cases, denying you particular coverage because they need to make their cash? Their business model is based to some degree on making sure that certain people don't get certain procedures. And I don't mean certain people from the standpoint of a particular race or demographic. I just mean if people got the medical coverage that they needed, it's very possible that those places go bankrupt, meaning it necessitates a certain avenue of that or a certain part of the company that looks at things and says no to something. Meaning you may have a nurse or doctor that takes responsibility of saying no, no, to experimental, to whatever, as opposed to having that stuff led entirely by your doctor. The middleman, the insurance companies, they're leeches. They're adding expense to a system that doesn't need to be there. Doesn't need to be there. You're paying millions just in their pockets. Those healthcare companies are banking millions of dollars, and the only thing there are is just an intermediary between those two things, something that Medicare does amazingly well, something that Medicare can take advantage of now, take over now. So I love this. I love this. Oh, by the way, yeah, pre-existing. My healthcare thing started when I was apparently 17 years old. The doctor said that the kidney failure started when I was actually 12 and that it just didn't get to the point where it presented until I was 17. My mom works at that point, 40-hour work week at a job that pays shit and piss. I think when she finished her job, I think she was making only like $14 an hour. That's nothing. That's nothing. She's trying to raise a kid on that. That's nothing. She ended up in a situation where she was always borrowing from one person to pay to the other. But in this very specific case, though, the healthcare thing became a slow leak. You're already barely making ends meet. And to that, you have a copay, and another copay, and another copay, and another copay. And then the kid gets sick, and the kid is in the hospital. Then the kid is in the hospital again. The kid nearly dies. Like, all of these things are eating away at the person over and over again because you have a hospital bill that you have to pay, as opposed to somewhere like the UK or France, where at point of service, there is no fee. You're putting that debt on the backs of people's heads. You're allowing these doctors to be somewhat predatory in the way they go about it. There will be people who will come into the room, take a blood pressure, and leave, and you'll get a bill for $100 because that asshole came to the room to take a blood pressure. This is somewhat of a predatory medical system, and I question, why do we allow this in this way? Why do you think this is a good thing? And why do we put people under pressure in this way? And is that really what you want, to put people of your society under if you don't need to? I don't say this in moralistic terms. I say this in terms that everybody at some point gets ill. Doesn't matter who you are, rich, poor, somewhere in between. I imagine rich fucks have all the money in the world to pay for whatever they need to pay for. So this argument is more so to the other 99%, or to the 99% that are vulnerable for this stuff. Why wouldn't you want to come together as a collective to say, yes, if nothing else, you could be a bum on the street, you're covered. I don't care your name. I don't care your race. I don't care anything about you. I don't care if you're a green alien. If we have the capacity to treat you, we're going to treat you. And yes, we have the means. We have the ends to do this. To some degree, if we don't have the money to do this, that's somewhat of an indictment of the capitalistic system itself. Meaning, if we, as a society, don't have the capacity to take care of the people in this society, that is a damning indictment of the capitalistic system. Thing is, Paul Ryan and all these other guys don't want to do it because they don't want money coming out of their constituents' pockets. That's the beginning and end of it. What they said just there was people were saving money is right. Bernie Sanders on this is right. And it's funny that it took a libertarian to validate the perspective that was being made. Now, the libertarian probably just raised the $32 billion number. But when you dig into the details, you're like, wait a minute, people are saving money. Yeah, but look at the price tag. Look at the price tag. I understand, but the amount we're going to pay for healthcare anyway is an astronomical price tag. We're saving money on that price tag. Pay no attention to the man behind the curtain. Pay no attention to the man behind the curtain. So I'll leave it here. I have a few more that I need to do, so I'm not going to keep this one long. Thank you all for joining me. I will see you guys in probably 10 minutes. Thanks, everyone.